This one is the OrthoMTA Biofilling Starter Kit. So when you open this, you'll be seeing set of instruments. So here, I'll be introducing the first layer. You have this OrthoMTA carrier. Okay. So here inside, when you push the pusher, you'll be seeing this one coming out where you can dislodge the plunger. Okay. This one is autoclavable. This one, you'll be doing chemical sterilization. Okay. Or you can just wipe alcohol since this won't be touching the patient directly. Okay. So when you put this back, it is important that you need to push this pusher again. Okay, so put it back, lock this really well. Okay. So if you see here, can you see the tip? This tip is very important. You need to check this before you put the needle tip, the disposable needle tip, because if you don't have that stainless tip, no OrthoMTA will push out when you're doing the treatment already. Okay, so this is very important. So after checking, you will be putting inside this disposable needle. Okay, this is the only thing that will touch the patient. So this one is the only disposable you have. Okay, put it inside, and then it is also important because this is a lure lock syringe, so you have to lock this one. Okay, lock it really well. Okay. So before you start, you have to check again if the plunger tip comes out. So again, you need to check if this comes out of the disposable tip. Okay, so put this aside. The next instrument we have here is this plunger. Okay, so this plunger, you're going to use it for coronal packing. This one, you can use this for when you pack for C-shaped canals, or if you need in a small diameter canals. Okay, so this one is the plunger. In here, these are the compactors. So this is the most important thing because you'll be using this to fill inside OrthoMTA to the root canal until the apical area. Okay, so if you see here, we only have one size. So this one is number 25.02 taper. So only one taper and one size. What we have na different is the length of the compactor. So we have 21 millimeter and we have 25 millimeter. Okay. This one is already in a reverse flute. So you're just going to put this one in a forward motion. Okay, so this one is the endomotor. You're just going to do it in a forward rotation. Okay, you don't have to do it reverse. Okay, so that's what we have. I'll put inside the compactor right now. Okay. Well, yung endomotor, it doesn't come with the kit. Okay. So here, the RPM that you have to do, it has to be as slow as possible. So it depends on your endomotor you have. If you have slower than 120 RPM, it's the best. But 120 until maybe 150, 180 is still okay. So if this is a slow, if this is slow, the compaction will be faster. Okay, so this one I will also set aside. Next we have here inside is a K-file, bender, and some paper points. But for the K-file, we place this one. This is to put a tunnel inside the field canal so that this compactor will go inside. Because this is naitay eh. So, once medyo nag-set siya, baka hindi nyo mapasok. Kailangan nyo gumawa ng tunnel for this compactor to go inside. Okay, so this is just a instrument that may be needed, so we placed it inside the starter kit. And the most important also for faster compaction is to have paper points beside you. Okay, so this bender, the usage for this bender is to bend the disposable needle. So for the girls kasi, we have medyo pointy finger nails. So if you bend this like this may cause a abrupt bend kasi. If ganon, wala kayong makikitang tip na lalabas kasi magsa-stop siya dun. So it needs to have a very smooth curve during the bend. So you're going to use this bender to curve it, okay, like this, okay, and you're going to use this again to unbend it also. So this is the usage for this bender. Okay, put it inside again. Going to the next level of the kit, you will be seeing cotton buds, the mixing tips, extra plunger, and then the water. This one is just a prepared water for your practice blocks. When you're doing the actual treatment with the patient, you can prepare a syringe with distilled water. Okay. It is better to use distilled water and not saline because saline still has a chemical component which will delay the setting, or it will still add on to another property. So better if you use distilled water. So this one is the OrthoMTA. This one is packed into 0.2 grams. Okay, so like in the lecture, we will be preparing a very conservative tooth preparation. So this will fit 3 canals of number 25 for the molar. And then this can also be used in a canine, which to start with has a very big diameter. So kasyang-kasya naman siya. Okay. So, and then this one is the disposable needle tips, and these are the practice blocks, okay? So, yung color yellow, that's the normal canal, and then the other color, it has like cracks, or may isa yung color green na with file separation, okay? So, here, I'll be using 1 block, okay? So we have prepared again this carrier with disposable needle, and then your endomotor with compactor. Okay, so I will be mixing first the OrthoMTA. So you're gonna get this one, 0.2 grams. You have an indentation here where the water line should be, but if ever na over siya, it's okay, because you're going to take out excess water in the end. Dapat putty type siya. You have to remove as much as water as you can para ma-fill up nyo dito sa carrier. Kasi kung watery yan, hindi siya magka-carry. Okay? So, open the cap, and then you're going to put water. After putting water, you're going to get a mixing stick. It has to be sterile. You can also use your K-files if you want. Okay. The mixing has to be like ice cream mix. Okay. Mix it well until the end. You really have to mix it well. Okay. Parang siyang ice cream mix, ganyan. Okay. But this is very flowy, so you have to remove excess water. Okay. You need to get the cotton bud and then press this one. Okay. press until the end. Press. Okay. You have to squeeze this out really well. You have to use the other side also to remove the excess water. Okay. So it will look like this. Compact na siya sa loob. Okay. And then now you're ready to use the carrier. Okay. Like again, as the name implies, the carrier is used to carry the OrthoMTA into the orifice only, so not into the canal. So this carrier again is used to carry the OrthoMTA into the orifice only. Okay. So now what you do is you need to get MTA. You need to fill the carrier. Okay. After you do it, para hindi sayang yung excess, take the cap to remove the excess. Okay? After that, di ba medyo madumi siya? Okay, what you do is, you have to press again with the cotton bud para ma-compact siya ulit for later. Okay. So here, I'll show you first. MTA will come out like this. Okay? So I'll show again. So that much MTA comes out. If ever maliit lang, it means hindi nyo pa masyado na remove yung excess water. So if ever medyo wet na yung cotton bud nyo, try to get another cotton bud to remove excess water. Okay? So again, another tip is you go through the wall para mas madami kayong makuha na MTA. Just go through the wall. Okay? And again, I'll show you one more time. MTA will come out this much. Okay? So now, I'll be putting na in the tooth. Okay. So carry this 3 times. Okay? Into the orifice lang, not directly like this to the pulp chamber or the orifice. Kasi once you put pressure, once you push this one, if walang space na lalabas, the patient will feel the pain. Okay? So you need to slant it a little and then push and then put it onto the orifice lang. Okay? So here, you see it's in the orifice. Okay? So you have to do this 3 times. Maybe you can train your dental assistant to do this for you. Okay. So, 2. So this is your 3rd na. Okay. By the way, I forgot. Before you do this step pala, you need to make sure that your working length is correct. Okay? I'm sorry. Before this step, you need to make sure your working length is correct. Okay? So this is just the same model. So I'm just going to check. So for this one, tamang-tama siya. Why is this important? It's because this stop and your reference point will tell you how much MTA you have put inside already. Kasi once you pack, this will go up. So the distance between this stop and your reference point, that's how much you have placed MTA inside. Okay? So, well, I forgot to mention, but you have to measure again. Even though tapos na kayo sa sa preparation ng crown down and everything, even though you're done with that, you still have to double check your compactor sa working length nyo, ng final working length. Okay? So, after you're done with the 3, after you carry it 3 times, what you do is, you have to put this inside first without having this rotated. Okay? So you have to put this inside until the working length, okay? And that's the time you start your endomotor, okay? Why? Because if you start this one dun sa gitna or not in the working length, you're going to make the apical stop there, okay? So the most important thing here, you need to go inside first until the working length and then turn this on, okay? So what you do here is you just have to stay there for siguro like 5 seconds, okay? 5 to 10 seconds, okay? So when you go up, that's the time you're going to get the one from the side and then push it down again, okay? And then I do it again. You can do this slowly because your compactor is the one who's going to pack it for you anyway. What you do is you just need to try to feel with your tactile sense, okay? If ever medyo watery siya, since yung canal medyo watery because of the dentinal fluid, what you do now here is you need to get paper points so that ma-absorb niya yung excess water para mas madali yung compaction. Okay? You need to put paper point and let it absorb first. Okay? And then go back to your compaction. So again, get it from the side. Can you see? When you rotate, the material goes to the middle, right? And then that's what you pack inside, okay? When you're packing inside, you already feel may stickiness na siya. Try it on your model also. You'll feel the stickiness. If you still don't feel the stickiness, what you do is put another paper point, okay? So, sa totoong case, I mean sa actual case nyo, if ever you feel na empty siya, try to put paper points first before you put more MTA. Kasi the main problem of why you're not feeling the stickiness and you feel na hollow siya, it's because watery masyado yung root nila. Okay? So, again, the most important thing is you need to try to feel the tactile sense, okay? This is a no-pressure technique. So, once medyo may na-feel kayo na may stop siya, don't force it inside because it means you already made an apical stop inside. So, you don't have to force it inside. For example, this one, medyo tumaas na siya. That means meron na akong na-feel na, na-form na apical stop. Okay? So, again, if you look at it properly, carefully, says if you get it from the side, MTA will form in the middle. Can you see may nagpo-form sa gitna? And then you're going to pack this one. Okay. After a while, this one kasi medyo mahaba siya eh. Okay. So, I'm going to put some more MTA. Sa actual case also, mas mabilis na siya. This one kasi it's a silicone inside eh. So, medyo nag-expand. But sa actual tooth kasi matigas yung dentin. So, it will feel kaagad. Okay. So, here. Orifice again. And then, if ever medyo makalat siya, you can just use your plugger to plug sa gitna. Okay? And then, you're going to use again this one. This time, you can turn it on na because you already have MTA. You already have the apical stop. Okay? So, go around. See? Can you see the MTA in the middle? That one, you have to pack it again. Okay? Go around, and then that's the one you're going to pack. Okay. Yan, medyo makalat na siya. That's the time you use this plugger to plug in between again. Okay? Medyo dry kasi to eh. So, ganyan yung kalat niya. But sa actual patient, hindi siya nagkakalat ng ganyan. Okay? So, actually, I'm almost done na. Because, can you see yung distance ng rubber stop and the reference point? This is almost like 4 millimeters na eh. So, actually, 5 millimeters is the best. Okay? Okay, I'm done feeling. Okay. This is more than siguro 7 already. Here, it nagsa-stop na siya. I can't go inside anymore also. Okay? So, yeah, that's it. If you see inside, it's already filled well. Ito kasi, baka sabihin nyo, kita kasi, right? If ever you have to repeat this again, example, periapical radiograph kayo right after. And then, if you see na sa radiograph, may mga voids na malalaki or you think na short siya, what you do is, you just have to get your water and then put it inside and dissolve it with K-file. Nadidissolve siya kagad. Okay? So, if ever you need to repeat it, it's better to repeat it that time. Kasi pag nag-set siya, mas mahirap kasi. So, if you feel it well, then you don't have to do retreatment. That's the most advantage thing about MTA. Okay? If nalagpas, it's okay. This is not like a sealer na magkakaroon ng discomfort. MTA is very tissue friendly, so the patient won't feel any discomfort. So once you're done, what you do is you have to remove excess MTA in the cervical area and then pack well. Okay. Pack well sa orifice. Okay. Get a wet gauze or cotton pellet to wipe this off well. Actually, for this one also, you can do one seating. If you're not going to do crown preparation or you don't need to put post, you can just seal this already. So, like, again, same with RetroMTA. You can just put GI liner and then you can do composite restoration. But if you're not, if you're scared or if you still want to observe the patient, if wala na talaga siyang pain or discomfort, what you do is you're just going to put cotton pellet and then put temporary restoration and tell the patient to come back like after 3 days for permanent restoration. Okay? So that's it. Here it is. Okay. So for example, you have cases na cracked tooth or file separation, mas better, you still have to repeat the same process when you're preparing the MTA. But sa tooth mismo, since you need the MTA to spread, you have to make it watery, right? So you're not going to make it watery from here pa lang. You have to make it watery in your tooth. Okay, so you're going to put water inside the tooth and not here. Okay, so that's the most that's the important reminder. Okay, so when you're done with everything, you have to tell your assistant to clean this immediately because this will set. If this will set, you won't be able to remove this disposable needle. Okay? If you won't be able to remove the disposable needle, you have to throw this plunger. This plunger is very expensive. So the most important thing after you're done with your patient, diba? After mo mag-radiograph and you see it's completely filled and you like the outcome, then you have to tell your assistant, finish na. So that's the time your assistant has to take this out immediately, okay? So wipe this one with wet gauze, okay? And then tell them to double check again kung lock pa siya or not. Tell them to lock it again and then put it back, okay? So for this one, this is disposable, so you need to throw this in a proper container pa din, since this is still a needle. Okay, and for this one, you can autoclave this, but before you autoclave, you also have to remove the excess empty kasi magsiset siya ganyan. Okay, so remove everything first, clean with other files. Okay, and then you have to you can autoclave this. Okay, so that's it. We're done.